Now that we're ready to actually start reading through our search pattern, what we're going to do in this video series is do a search pattern that goes outside in. So we're going to start with the subcutaneous tissues, and then we're going to work our way inside the body. There's a lot of different ways to do a search pattern. This is just one example, but when you're ready to start looking at the subcutaneous tissues, I think it's very important to make sure that you're windowed appropriately. There are soft tissue windows that some systems have, or some soft tissue presets. I use the abdominal window to look at the soft tissues. I think it works pretty well. And to do this, basically you come to the top of the scan, and then personally I divide the soft tissues into 4 quadrants, kind of, anterior, posterior, right, left, just like it's labeled here. And I actually start with the anterior surface because it seems like that's where most of the pathology is. So as you start at the top, you just scan down slowly, looking at the anterior soft tissues. And a lot of what we're looking for are things like hernias or soft tissue defects, any air. As we come down here, we can see we're coming actually to the umbilicus. This is why the reference lines are so helpful. So this is normal. That's just the umbilicus there, but we're keeping an eye out, looking, to see if there's anything that's herniating between the muscles into the soft tissues. And as we kind of scroll down here on the anterior surface, we see a right inguinal hernia. That's what this is right here, and this is actually fat that's within the hernia. So what we can do is kind of scroll up and down and follow the hernia all the way down, make sure that there's no bowel in there. Doesn't look like it, but what we do see are these little high density foci here. This is probably evidence of a prior hernia repair, so that's probably what they use to tack in the mesh. So already by just looking at the soft tissues here, we know a little bit about the surgical history of the patient, even without a history. Now, once we come down here too, we see these little structures that pop in and out of our view, like this one right here. So as I scroll up and down, you can see it pop in and out. Those are our lymph nodes, those left inguinal lymph nodes right there. And these don't look to be too enlarged, but this is what you're looking out for. You're making sure that there is no large or suspicious looking lymph nodes in that area as you're looking at the anterior soft tissues. Now, once we get to the bottom, I think it's very efficient to look at one quadrant as you go down and then another quadrant as you go back up. So I actually go to the posterior quadrant here now because I feel like this is also a good place for pathology to hide. And when you're looking back here, you want to look for things like perirectal abscesses. There can be decubitus ulcers that are tracking down. So there can be abscesses, just even in the soft tissues. So you can just kind of scroll up, looking at the posterior soft tissues, making sure that there's nothing abnormal, nothing unusual. And we just scroll back up to the top. And then you can look, let's say we can just look at the right side, just to make sure there's nothing unusual. Sometimes things will herniate out of the chest or the abdomen, even on the lateral aspects. So it's important to just take a look. You can go down, and then we'll switch over to the left side, and then we'll scroll back up, looking at that quadrant as well, just making sure that there's nothing abnormal. And now we've looked at all the soft tissues. As you get more comfortable, you may be able to see more of the soft tissues. So maybe you don't need to do 4 quadrants, you can do 2 halves, whatever you're comfortable with. But I think it's very important to kind of make sure you hone in on the areas that give you the most pathology first. And then you kind of alternate between what you're looking at as you're scanning down the abdomen and then up the abdomen, so you are efficient. But that's the kind of the initial looking at the soft tissues.